We used iPads as our digital solution. We were looking at how we could support staff through the COVID pandemic, and we used it because at that point we had to be using something remote. We weren't able to go into the care homes at that point, so the iPads allowed us to connect with the staff and the managers. Our project was really putting psychological support into the care homes, both for the managers and the staff. We actually looked and thought maybe smartphones would be a good use at that point. But for anybody that's used digital meetings through this time, if you can't see someone's face, it's really difficult to share. And we found that, and it was something that we thought of quite early on, luckily in the project, where you could only maybe see one person's face, and that's really quite hard to sort of share things, especially in the sort of psychological sort of level. So we felt it was much better if someone had an iPad and they could see the responses to everyone else. So that made it more connected. People being able to actually see other people, because we were doing it with some staff who didn't know each other at all, so they didn't even have that connection before, especially when we did the Echo project, where it was staff from all different care homes who'd maybe never seen each other before. It might have been a bit different for the managers, who some knew each other, but for the staff, they were meeting somebody sometimes for the first time, and I think that would have been much more difficult on a smartphone where they could only connect with one person. So it really made a difference, allowing staff to open up and share. It was for any staff at all that sort of worked in health and social care, our project. It was mainly used by the staff within care homes and the care home staff who all came together, and they were able to use the iPads. Some people didn't have a smartphone, so weren't going to be able to use it at home. So we wanted something to allow staff, wherever they were, to be able to take part in the sessions. So if someone wanted to take part and they went on duty, they were able to borrow an iPad and take it home. Just for the social distancing issues that we had as well, even if staff were working, homes didn't often have enough digital solutions to make it possible for staff to take part, because they had to be in different rooms, especially if they didn't have a lot of iPads. Even if they did have a few iPads, they were trying to do so much with the technology. They were trying to connect families at that point as well. There was maybe clinical sort of situations where they were talking to district nurses or GPs by using Near Me with their own iPads. So we had to have a solution that didn't impact on the rest of the work at this time within care homes. I think it's had a really positive impact, mainly because having more iPads allowed us not to have an impact on any of the other work that was going on in the care homes. Initially, some people were really worried. They didn't want to take that time away from relatives because it was really difficult for them to have contact. So it allowed the staff to be able to do that and not feel they were impacting on anybody else's communication within the home. So that was really, really important. It allowed any of the staff to take part, so not having a smartphone or anything digital at home didn't have an impact. We were able to give them that. And of course, we had to have a whole scenario of how we cleaned those and sort of shared them within the staff, which was a bit new for us as well. So we had to go down the road of sort of realising how to sort of clean them and store them and be able to share them safely. So that was a bit of a challenge, but we came through that without a hitch. But it was really important to allow as many staff as possible to take the benefit of some of this support. The work we've been involved in has been really important, and it's not finished. I think the care homes and the care at home staff will need support for quite a while to get through this. But going forward, we have a plan to start a project of spaces for listening. And this is where we're planning to have 2 sessions every month where any staff at all can book themselves in. And it's a listening project, really. It's where staff can come together. There's usually about 8 people per session, where people can just be listened to. And I think that's really important, that there's going to be something going forward. So from November, we plan to have 2 sessions every month with some of the staff involved. that sort of were in the steering group for the project. So that's quite exciting, and we plan to sort of use the same issue if someone doesn't have the ability to have something digital to take part in these, that can be lent to them again. And I think that's really important to sort of carry that forward, especially as we're looking at more of the care at home staff as well, who may be out and about and maybe just have a phone, but if they had an iPad to be able to connect, they could maybe do it in a break or lunchtime. We plan to have that at lots of different times in the day to try and cover as many staff as possible. So we're even going to have some evening sessions for staff going in night shift. I think my advice to anybody would be just go for it. Sometimes people think that it'll be a barrier, but we haven't found that at all. Actually, we find it really beneficial, and people have even said it's made them feel human again to be able to connect. And I think that with using technology actually takes away, people think that's quite robotic, but I think for anybody who's used technology in this way, it's actually been invaluable, especially through the pandemic, to connect people. So I think it is, go for it. If you've got an idea that you think might be able to be used, I think it'll only benefit it, and be able to connect people together, whoever they are at all.